Hi, my name is Ethan, and I'm here with Jose, Maya, Lauren, and Andy to introduce our solution to aortic valvular disease, a cardiac stem cell tissue-engineered aortic valve replacement.
Valve disease has become increasingly prevalent in modern society, with over 5 million new diagnoses annually in the US. In particular, aortic valve disease is the most lethal, accounting for 61% of valve disease deaths in 2017 alone, of which aortic stenosis, or AS, is the most common. AS commonly arises due to valve calcification from aging, but can also originate from congenital defects or infectious disease. In AS, the aortic valve is narrowed and can't fully open and close, which reduces blood flow to the body and causes backflow into the left ventricle. As life expectancies have increased over the last 20 years, global deaths due to AS have also increased by 138%. It's estimated that up to 1.5 million Americans currently have AS, with 250,000 of them experiencing severe symptomatic AS. For those in this group, valve replacement is crucial, as up to half of these patients won't live beyond 2 years of symptom onset without one. And for those with inoperable AS, there's a 5-year survival rate of 3%.
Hi, my name is Lauren, and I will be going over the existing valve replacement options that currently dominate the AVD field and their limitations. Current replacements can be separated into two categories, mechanical and tissue. Mechanical replacements are typically made up of metals, carbon, ceramic, or plastics. The most common design is the bileaflet design shown below. The components are non-reactive in the body, however, individuals with a mechanical valve replacement face an increased risk of clotting and must be on anticoagulants for the rest of their lives. It has been theorized that the mechanical valves create increased turbulence and lead to blood clots over time. Because of this constraint, mechanical valve replacements are not good for those who may wish to become pregnant in the future or cannot be on anticoagulants for other reasons. Tissue replacements include biological valve replacements and human homograft replacement. Biological valves may have some artificial support mechanisms, but are primarily made up of bovine, porcine, or pericardial tissue from another species. Human homografts are directly taken from a human donor and implanted into the patient. Due to limited availability of donor valves, homografts are not very common. These replacements avoid the need for the use of anticoagulants over time, but do not last as long as mechanical replacements. It has been theorized that immunogenicity plays a role in the degradation of these implants over time. This being said, tissue replacements are not recommended for children and young adults. Based on these existing therapies, there clearly exists a clinical need for a valve replacement that could be used in young patients who otherwise cannot use anticoagulants.
Due to the unfavorable complications, diseases, and deaths caused by heart valve replacement failures, the demand for a new material suitable for heart valves has increased. Our solution proposes an artificial aortic valve made of polyester urethane urea that will be electrospun into a scaffold. Furthermore, our scaffold incorporates endogenous cardiac stem cells as a bio-based coating to further inhibit thrombosis and calcification. Ultimately, our scaffold can simulate the replaced aortic valve, support and stimulate endogenous cells, and avoid structural failure, calcification, thrombosis, and valve degeneration. Briefly, electrospinning works by applying a specific voltage to establish an electric field between the needle tip and collector. The polymer is then ejected to the collector, and a violent whipping motion between the cone and collector results in a fiber network on the collector. Our solution will utilize this method to create the material for our valve. Polyester urethane urea is already a commonly used material for medical applications due to its versatility, biocompatibility, hemocompatibility, and durability. Electrospun scaffolds were chosen for our solution because they can emulate native soft tissue mechanical behavior. They can also be fabricated to have a well-aligned fiber network, which is an important property for mechanically anisotropic soft tissue such as biological heart valves. Furthermore, living cells can be integrated into the scaffolds at the time of fabrication, which overcomes the limitations of cell permeability seen in other electrospun fiber scaffolds.
Hi, in most aortic valve procedures, a stent is required with various sizes of valves. There are different designs of stents. A living stent is highly favorable in gene therapy and minimizes spread to the body and maximizes permeability through endothelium. We can see this as being used for cardiac stem cells and aortic valve procedures. There are currently many clinical trials involving cardiac stem cells for treating heart diseases. Here's a quick timeline from 2008 to 2025. Improving biocompatibility of aortic valves procedures seems to be highly promising.
In summary, our clinical need, aortic valvular disease, affects millions in the United States annually. Our solution to create a new artificial valve is twofold. First, we'll use a promising electric spun material that emulates native soft tissue mechanical behavior and can integrate with living cells as scaffolding. Second, we will deliver cardiac stem cells using gene-eluting stents to build on top of that scaffolding and function as the new replacement aortic valve. With all that being said, here is our works cited And thank you so much for listening to our presentation.